All right. Hello, everyone. My name is Megan. I'm a student physical therapist at Widener University.
I'm Joey. I'm also a student physical therapist here at Widener.
And I'm Allison Hans, and I'm also a student of physical therapy at Widener.
So, we're going to be presenting about mindfulness so that people can decrease stress when they have AIDS. So, to get started,
First, we'll talk about HIV. HIV is also known as human immunodeficiency virus. It's a virus that affects the immune system, and if left untreated, it can turn into AIDS, which is acquired immunodeficiency syndrome. This is a virus transmitted through the sharing of needles, through sexual intercourse, anally or vaginally, and there are three stages of HIV. The first one being acute HIV infection, which is a large amount of HIV in the blood, flu-like symptoms, and can be contagious. Stage 2 is chronic HIV, and that is HIV that is active but reproduces slowly. It can be asymptomatic, and not many individuals experience symptoms at this stage. Stage 3 is AIDS, as I said before. It's the most severe infection, and you have a very poor immune system. It's very infectious, and without treatment, your life expectancy is about 3 years. AIDS symptoms can include extreme fatigue, cognition deficits, weight loss, swelling of the lymph nodes, oral problems, and much more. And it can severely affect daily occupation.
so there are around 1.2 million people in America that had HIV by the end of 2018. About 1 out of every 7 didn't even know that they had HIV. In the United States, Black Americans are most affected, followed by Hispanics and Latinos, and lastly, whites. Young people between the ages of 13 to 24 are especially affected by HIV or AIDS, and gay or bisexual men between those ages account for the majority of those cases. HIV destroys T cells, also known as CD4 cells, which protect the body against common diseases and infections. So people with HIV and AIDS can develop many symptoms depending on the stage of infection because of the decline of the immune system and decline of the T cells, which are infection fighters in the immune system. And on this slide, you can see some of those different symptoms and signs that can happen due to this.
HIV/AIDS can severely impact the individual's daily occupations, making it difficult to maintain activities of daily living, instrumental activities, health management, sleep, work, social participation, and so on. For ADLs, activities that involve standing and focusing, they can be difficult due to fatigue and cognitive deficits. This could impact getting up in the morning, doing your normal routine, causing more safety hazards like falls and things like that. Same for IADLs. This could impact driving, doing chores, etc. With health management, there's more doctor's appointments to make due to your symptoms being attacked. HIV/AIDS also causes poor oral health, diarrhea, sores in the mouth, anus, or genitals, and more. Work can be difficult due to being fatigued and causing cognitive deficits, and the social participation will be impacted if the person hasn't coped with the diagnosis. This can cause them to be depressed, embarrassed, or uncomfortable, and the fatigue can also prevent participation.
So we're going to be talking about mindfulness, and the definition can be explained in a multitude of ways. But overall, mindfulness is the ability to focus on your emotions and control them in order to produce clear thoughts. So mindfulness uses breathing techniques to control one's breathing and allow them to become aware of their feelings and emotions so that they can accept them without judgment. It allows one to learn to let go and control emotions in a healthier way. Mindfulness can be done whenever and however long one chooses to, and it can take up to 3 minutes or up to half an hour to complete and can easily be incorporated into daily living.
Mindfulness will lead to knowing what symptoms a person with AIDS might face and sharing that with other groups, members in the population of ACG, may make people in that group feel validated This may increase the feeling of support that is provided for some people in ACG and how other people can utilize common supports given to those people with AIDS. People typically experience stress, and when facing chronic illness, stress can commonly be increased. And with the practice of mindfulness, people will become aware of what the typical stress responses are and how to handle them with certain skills like deep breathing. When someone takes advantage of deep breathing during a stressful situation, heart rate and blood pressure will be decreased during the typical fight or flight response. With these mindfulness techniques, people with ACG will be included into society, which will lead to more of a representation of oppressed groups in society. For example, people a part of the LGBTQIA+ community who are commonly impacted with AIDS will be portrayed in the public.
So for some mindfulness practice, for some mindfulness practice, you can try and set a goal to practice mindfulness a certain amount of times each week. And this can be practiced during any time of the day. And you can practice like while making your coffee or taking a walk or just doing your daily tasks. And a suggestion would be that when you're feeling stressed, you take a break to practice mindfulness. And some ways that you can do this is by paying attention to what's going on around you and how your body's feeling, living in the moment, accepting yourself, and also focusing on your breathing.
And here is a 5-minute guide for you guys to reference while practicing.
So let's start by getting comfortable. Make sure you're seated comfortably, whether in a chair or a cushion on the floor, and sitting upright. You can do this meditation laying on your back, but generally it's best to do this meditation sitting. So again, have an upright but comfortable posture. Rest your hands in your lap or arms in the chair. And with your eyes open, take a few deep breaths. In through the nose and out through the mouth. On the next out breath, gently close your eyes and relax your breathing. Allow your breathing to return to normal. Now, bring your attention to your body. Notice your weight on the chair or on the floor. Notice the points of contact, any physical sensations. Begin to notice your feet touching the floor. Notice your legs on the chair, your arms resting in your lap. Notice your back against the chair. And continue to focus your attention on each of these physical points of contact for a few moments. Now, begin to notice your breath. Don't change your breathing, just notice the natural state of breathing. Notice if it's shallow or deep. Notice how your breath flows in and out. Again, make no effort to change the way you're breathing. Simply notice each breath as it passes. Notice the rising and falling sensations of breathing. The rise of the inhale, falling sensation of exhale. Maybe it's more noticeable in your chest or stomach. Just place your attention here for a few moments. Now, begin to notice any stray thoughts, but don't dwell on them. Maybe they're events of the day, things you still need to do, your mind becoming restless. Don't follow these thoughts, just notice them and return your attention to your breathing. And when your mind wanders, and it will, gently return your attention back to your breath. Watch as your breath continues to flow deeply, calmly. Notice the flow of each inhale and exhale. Notice the stages, each complete breath, from the in-breath to the pause that follows, and the pause before taking another breath. Feel the air entering through your nose. Notice if the air is warm or cool as it flows down to your lungs. Notice how the space inside your chest becomes bigger with each inhale, smaller after you exhale. Now slowly turn your focus back to the physical points of contact, back to your legs or feet on the floor, back to your arms in your lap. Notice your back against the chair. Slowly open your eyes and notice how you feel. You've completed your mindfulness meditation session. And with that, I hope to find you back here for the next session. If you've enjoyed this guided meditation.
All right. So hopefully that gave you a good idea on how you could practice mindfulness during the day. And if we go to the next slide, we're going to the next slide. So our next slide is just our references for the information that we shared with you today. And we hope that this gives you a little more insight on mindfulness, why you would practice it to reduce stress in your life. And we hope that this could be really beneficial to the AIDS care group. Thank you.